If you are pregnant or you've recently had a baby, this podcast is for you. I am your host, Kath Bequee, a physiotherapist working in women's health and mum of three. Inside my online program, Fitness Mama, I just love helping support women to care for their bodies during pregnancy, prepare their bodies for birth, and support their after-birth recovery, helping them feel confident and strong inside out during this important stage of their lives. In this podcast, join me each week as we dive into all things pregnancy care, childbirth, and postnatal recovery, helping you through every step of the journey. It is absolutely possible to feel amazing and confident in our bodies during this motherhood journey, and I want that for you. Come and say hi to me on Instagram at @fitnessmama, and let's dive into today's episode. Hello and welcome back to the Pregnancy, Birth and Recovery podcast. Today's chat is beautiful. It's with the lovely Ellen, who's a member inside Fitness Mama, and she shares her birth story or pregnancy journey, birth story and recovery. And it's a beautiful chat. If you're pregnant, if you want to hear a beautiful, positive birth experience, this is your podcast episode. I didn't realize, Ellen is a member inside Fitness Mama. She's also a women's health physio. And as I mentioned in the podcast, but we do have a lot of health professionals join us inside Fitness Mama in the app. And as both a member of Fitness, but also as a fellow professional, women's health physio, it was so great to hear her story. And she gives some really great, valuable tips and tricks that helped, I believe, really helped to support her beautiful, positive birth experience and her postpartum recovery. So in today's story, Ellen shares her first pregnancy. It's her first bub's born. She shares her experience with pelvic girdle pain during the second trimester. She talks about perineal massage, what birth preparation she did. She takes us through the stories of her waters breaking, the use of the TENS machine, her birth experience, which is really quite remarkable, and then through to her postnatal recovery and how she's navigating that and mastitis as well. So, yeah, really valuable episode today. And it was probably the perfect sort of podcast birth story that I would have wanted to listen to myself with my first baby. So you're going to love it. Before we do dive straight into it, if you value this podcast, I would really so appreciate it if you could share it with a friend, share it on social media, share it with someone. I don't run ads to this podcast, and I do rely on all the listeners, either liking and reviewing the podcast or sharing it with a friend, someone else who's perhaps pregnant, or someone who would benefit from the episodes, because that's the way that this podcast gets heard by more people. So thank you so much. I value you. I value your time today. Let's jump straight into this episode. I really think you're going to love it. Ellen, thank you so much for joining me on the Pregnancy, Birth and Recovery story. It is amazing to have a chat today, and I appreciate you taking the time because you're busy. You've got a little 3-month-old bubs, little girl. Is that right?
Yes, yep. I've got little Mabel here, and thank you for having me on. It's a privilege to be able to share my story.
Yes, and you've been a member inside Fitness Mama. You're one of our lovely mums. How long have you been a member now for?
I've been a member since I was probably about 2 weeks postpartum, when I wanted to start getting into exercise again. And I've been, really enjoying the classes ever since.
So 2 weeks postpartum. Let's hear your story, Ellen. It's your first bubs. How was your pregnancy?
So my pregnancy, it honestly went really smoothly. The first trimester, I think I kind of felt in my body that I was pregnant before I got the positive test, which was really cool to experience. And then first trimester, I had a bit of nausea, mostly in the mornings, um, that passed by about 11 or 12 weeks. But my biggest first trimester symptom was probably more fatigue, which was awful. And that was probably worst around 8 to 10 weeks, and
Okay.
then slowly got better.
Yeah.
Um,
And was this a planned
so
pregnancy, Ellen?
it was very much planned and looked forward to, and we were really blessed to have quite a simple
Yeah.
conception journey, which was amazing. I went off the pill in July, I think it was, last year, and we actually conceived probably 2 or 3 weeks
Yeah,
later,
wow.
which we weren't expecting, but it was so
Yeah.
exciting. So that was amazing.
Yeah, fantastic.
Yeah.
And how long had you been on the pill for?
It had been 3 years, I
Yeah.
think.
Yeah.
Yeah, so not huge amounts of time, but I was really excited to get off it
Yeah.
um, as well.
Yeah,
Yeah.
amazing. And in terms of staying well during pregnancy, you had the fatigue. Did you have any aches and pains? Like, were you able to still move your body well during pregnancy? How was that side of things?
Um, I did have some aches and pains. So second trimester started off really, really smoothly, and we actually went on a big trip to Europe when I was 20 weeks pregnant, I think.
Nice.
And by the end of that trip, I was probably 24, 25 weeks. I had started to get a little bit of um, back pain. But we walked so much on that trip, and I don't feel like the pregnancy really got in the way of
Yeah.
it, which was amazing. Um, then things kind of calmed down a little bit, and around the start of the third trimester, I went for a walk on the beach, which was lovely. But after that, I got some pubic symphysis pain, and it took a few weeks to kind of get that in control. Then I was just managing it, and it did get worse right at the very end again, but I just really reduced how far I was walking and changed up what kind of exercise I was doing a little bit.
Yeah.
Um, and yeah, it was a lot more painful than I thought it would be at times, but I was able to kind of keep it in control by the end.
Yeah. And did you need to get any help for that pubic symphysis pain?
I didn't. I'm actually a women's health physio myself, so I just did all like the different things that I would tell my patients to
Oh my
do, but I didn't
gosh.
actually get any hands-on
I,
treatment.
I don't know if I didn't know that or if I knew that and I forgot about that, but that is cool. There's actually a lot of physios that end up joining us inside Fitness Mama. Um, did I know that, Ellen?
It's I'm not sure.
Yeah.
It's just so good to
So
take the
good.
load of what exercise I should be doing and everything to look after myself.
Yeah.
Like, I just don't need that load right now in early
Oh,
postpartum. So the program's been awesome, even
abs-
though like professionally I work in this space.
oh, I totally understand you. And I remember doing the same thing with pregnancy and postpartum. You want to be told what to do. Like, you've got too many
Yeah,
tabs in your brain. You don't need to think about what exercise to come up with or how to best manage, you know, your recovery. Like, sometimes I think just that
yeah,
power of step one, step two, step three, tell me what to do.
I do.
Yeah.
I completely agree.
Oh, that's cool.
Um, yeah, so it was also really interesting for me to experience some pelvic girdle pain and kind of try those simple things that we recommend, and it made a really big difference.
Yeah.
So it's a big like learning and something for me when I do go back to work to remember what worked and what didn't, and
And
yeah, just learn from my
and what did
experience.
you find worked the best for you with the pelvic girdle pain?
It was just the keeping your legs together. I call it like the mini skirt mentality. Like when I was exercising, I wouldn't do a wide squat or a lunge. I would just do a simple narrow squat.
Yeah.
Um, I remember one time bringing the bins in off the street really ramped it up, I think, because I'd kind of kicked the bin out to get it up on its wheel. So that was like a one-legged
Yeah.
situation. I was like, okay, I'm not doing that
Yeah.
anymore.
For me, it
And
was
just like getting around the
push.
car.
Oh, yeah. Yeah. For me, it was
Yeah.
pushing the fruit, the vegetable drawer in the fridge, pushing that
Oh,
closed
yeah.
with my foot, which I do all the
Yeah.
time naturally. And you do
Yeah,
it
for me.
almost subconsciously, and then you're like, ouch, I shouldn't have done that.
Yeah,
Yeah. Um, yeah, really interesting. Yeah, good tip, top tip. Physio's top tip for dealing with
absolutely.
pelvic girdle pain. But it's also a
Absolutely.
fine
Yeah.
line, isn't it? And this is talking, I guess, physio to physio. It's a fine line between trying to prevent movements, but also you don't want to become fearful of certain movements, because sometimes if women are
Yeah.
so scared about, going single leg, and some, it can almost, I don't think it's helpful at all in terms of pain reduction. And sometimes
I
single
completely
leg
agree.
work is actually really good, but it's got to be done in a way that's, anyway, we're getting a bit technical here.
Yeah, I completely agree. It's just managing the load and the amount of it, I think. And
Yeah.
yeah, I completely agree.
Yeah. Okay, so you skirted around the potential of pelvic girdle pain during your second trimester. You were able to navigate that really well. Now,
Hmm.
approaching your third trimester, when I guess birth's coming, is approaching, what was going through your mind? Did you know one of the best ways to support your postpartum recovery is through exercising carefully during pregnancy and preparing your body for birth? And this is something we cover inside Fitness Mama. This is what fitness is all about with its physio-created workouts. We help you support your changing body during pregnancy, whether or not that's with pelvic girdle pain-friendly workouts, whether or not that's with strength training for pregnancy or pregnancy yoga. We help you to prepare your body for birth and reduce your risk of third and fourth degree perineal tears and episiotomy. And we help to boost your postpartum recovery, whether or not you've had a vaginal or a cesarean birth. If this is something you want to do, then come and check out our free 7-day trial. You've got nothing to lose, everything to gain. And at the end of the day, it's all about helping us have a better motherhood experience, to help us feel stronger inside out in every aspect of our life: physical, mental health, confidence. Anyway, I could keep on going, but come and check out the link in the show notes and join our free 7-day trial. See you soon.
Um, to be honest, I got to the point where I was really excited about it. Um, which looking back was incredible. And I've shout out to my mum for really de-threatening birth to me and helping me to see that it can be a really beautiful thing. Um, so yeah, upon reflection, I think that was conversations that she had with me really intentionally all through my teenage years and childhood.
Tell us a little bit
Which
about what conversations you're having.
Um, well, I think it all started when, so I'm one of four kids. I'm second eldest. And my mum had three beautiful vaginal births, and then her last baby turned into an emergency cesarean with a lot of because of a massive um, hemorrhage, which started while she was still at home when her waters broke. And I was there. I remember really vividly her standing at the phone with yeah, blood gushing out. I think I was about 8.
Wow.
And after that, I think she, during that experience, really stayed so calm and, um, yeah, just how she kind of conducted herself through that. I don't remember seeing that as a super scary thing at the time. In hindsight, I'm like, whoa, now that, I'm older, like, wow, that would have been crazy for my mum. Um, and then afterwards, she had some conversations with me where she really um, she just talked to me about what birth can be like and how obviously you've got help there when you need it, and shared her really positive stories that she had with um, the elder three
Yeah.
babies. Um, and yeah, like just followed. She's a breastfeeding counselor and things like that with the ABA, so
Yeah.
she's been in that space for a lot of
Oh my gosh,
time,
that's the
and
best
it's
mum
just really
ever when you start breastfeeding.
it's been incredible. Yeah, yeah. So I think now that I have a daughter,
Yeah.
hopefully I can kind of do that for her one day too, because I think that was really massive in my mental headspace leading into the birth.
Yeah.
Yeah, which was incredible.
Yeah, interesting to hear that, because you're right. A lot of what we always like to say, childhood hasn't affected us in so many facets of life, but it totally affects us. And I think that's one
Absolutely. Yeah.
example where if we're mindful about how we speak about things, it can really make a positive impact from a young age. And I've got 3 daughters, so yeah, that's really good to hear.
Yeah,
Taking a mental
absolutely.
note here. Thanks, Ellen.
Thanks, my mum.
Um,
Um, we also did, Tom, my husband and I also did a birth course. It was Born Ready, I
oh,
think it was
yes. Yeah,
called,
yep. Beautiful.
um, which was great. And it was just so good to give us the practical skills and ideas of actually what do we do in labor and yeah, just to build that toolkit.
Yep.
Um, And the other thing that we did was a lot of, well, for years I've listened to lots of birth story podcasts and things like that.
Yep.
And I shared some with my husband and things like that as well, just to help him to kind of have a little bit more knowledge behind him as well.
And were you mindful of what type of birth stories you listened to?
During the pregnancy, I was. Before that, I listened to everything.
Yep.
It probably links in with my interest in women's health
Yeah.
and
Yep.
everything. I just, for years, have listened to heaps of them, but especially as the pregnancy got on,
Yep.
I did listen to more positive stories.
Yeah, because I'm always mindful, obviously there's birth stories in the pregnancy at this podcast, and I really feel some birth stories, and I always say this in the introduction to the podcast, this birth story is perhaps one that's worth listening to after giving birth if you've
Yeah,
had
yeah.
concern. Like, it's not for me to say who should listen, who shouldn't listen, but I really do think some birth stories lean perfectly towards those who are pregnant versus those who are perhaps
Mhm.
recovering, and
Yeah.
and even if it was a difficult recovery or there was birth trauma, I think they're really valid stories for those in that same situation. But yeah, it's a time and a place.
Yes, yeah, absolutely. And all, yeah, all really valuable and for different people at different stages.
Yeah. So, as a physio, women's physio, you're aware of, I guess, the pelvic floor aspect and the pelvic floor trauma
Mhm.
that is associated with, can be associated with vaginal birth. Did you do, apart from Born Ready, did you go about, because I know you didn't join my program until after birth, did you go about like perineal massage? Like, how did you go about protecting, putting your body in the best position possible for birth?
Mhm. Yes, I did. I went to a pelvic floor physio myself. Sorry, Mabel. Um, from the second trimester and started doing exercises appropriate to me,
Beautiful.
which for a long time was more working on relaxation and down training,
Yep.
which is really common for first time
Yep.
mums. Um, and then I did do perineal massage from 36 or 37
Yep.
weeks as well. And I was doing just at home, really basic, simple strength exercises like squats and core stuff and upper body stuff and um, all of that. I probably lasted until about 36 weeks,
Yep.
doing that maybe 2 or 3 times a week at home.
Yep.
And then it started to feel a bit much, and I kind of just was doing some gentle walking
Yep.
and things like that after that. Another thing that my physio got me to particularly work on was stretching out my adductors, my inner thigh muscles, and working on like some hip mobility and that kind of thing,
Yeah. Beautiful.
which was also, yeah, really, really good.
Yeah. Yeah. Lovely. So for those listening, one of the best few things you can do to help with your postnatal recovery is to continue exercising during pregnancy. And I think that's so exciting because, you don't need to spend time doing anything fancy. Like, let's just keep moving our body during pregnancy in a way that feels good, which is exactly what you did, Ellen. And then secondary to that, you went and sought sort out that personalised input. So you were on a perineal massage plan, you're stretching out your hip adductors, you were putting, I guess, everything forwards to help give your body the best chance of success. Is that how you thought about it?
It was partially just, obviously I want to do everything in my power to make this process the best it possibly can be for my body, and partially really wanting to try out a lot of the things that I talk to women about on the day-to-day at
Yeah.
work. And I was quite excited to have my own journey in that and experience what my body was going through.
Yeah.
Because obviously we learn so much theoretically
Yeah.
about it, but then to experience it yourself is a whole different kettle of
Next
fish.
level.
So I really tried to try everything.
When I was going with my first bubs, it's nearly 13 years ago now, and we just didn't have the research around the perineal massage, and Epino was quite commonly used. And I just could not get my head around I did not want to use an Epino during pregnancy. Like blowing up a device inside body was just not something that, I was like, oh, you know what? There wasn't great evidence for it. So, I think if obviously you do the best you can with the knowledge that you've got at the time, but things have changed a lot in the last decade with preparing for birth, and it's a really exciting space. So you don't have to stick up. Like, there's still a place for an Epino for anyone listening, but the research leans towards, at this stage, perineal massage, which is free. It's no devices required. You don't need to buy anything special. It's just a matter of learning the technique.
Yeah.
Beautiful. Okay, so talk us through those last, let's get to the pointy end now. Let's approach birth. Like, you've done all the things in the third trimester. How did birth transpire? Take us on the journey, Alan.
Yes. So pregnancy continued to be really smooth all right the way through the third trimester. I did have one instance of going into emergency for some extra monitoring just with reduced movement. In hindsight, I think maybe Mabel, because she was bigger and getting more engaged, just how the movement felt might have been a bit different. But yeah, my midwife really encouraged me, just go in, get the monitoring. You can't do that too many times. So that was really good advice from her. I was part of the MGP program at the Mercy here in Melbourne. So I had my own incredible midwife who I saw once a week in those final weeks. And then we also had a backup midwife who we met a couple of times in the pregnancy as well. And she was really intentional to really get in my head and Tom's head and learn what our priorities were and what we were kind of hoping for. I guess you can't really have a birth plan, but she wanted to understand where we were at, even in those few times that we met her. So we felt really confident going into the last few weeks that whether we had our primary midwife or the backup one, we had someone who knew us and who, would look after us in a way that, what's the right word? Really appropriate for what our preferences were, I guess.
Yeah, beautiful. You felt supported and confident moving in.
We did. Absolutely. The day that labour all kicked off, I was 39 and 2. I kind of had in my head, I was trying to feel like, kind of have in my head, we could go to 41 weeks, we could even go a few days after. So it almost caught me by surprise when I woke up and my waters broke. So just lying in bed, I just felt a wetness and I was like, oh, have I weed myself? That would be weird. This is a lot of water. No, wait, this must be my waters. So I kind of got up and ran across the house to the toilet. And it was definitely my waters. Yeah. So that was 7:00 in the morning. It was about 10 minutes before my husband normally leaves for work. So really good timing that I could say, hey, you actually need to stay home. Yeah. And he called in and said, I'm starting my paternity leave now and everything. So I
Oh,
was
that's
really
good.
relieved not to have to make the call bringing him home from work.
Yeah.
He's a teacher and, getting someone to cover the class and everything.
Yeah.
Um, so after that, I put in a big pad. I put in like a urine incontinence pad, which was fantastic to catch all the waters. And then I called my midwife. Um, and it was my primary midwife's day off. She had the 2 days off. It was her midweek weekend, so we had our backup midwife. But that's where, in hindsight, I really appreciated the effort she went to when she did meet
Yeah.
us. I really felt confident having her. Um, she said she kind of talked me through the things that I could do at home to kind of hope to get contractions started naturally, because at this point my waters had broken, but I hadn't had any contractions. So she was just saying, express a whole bunch of colostrum and gentle walks around the block if you can. And I spent a lot of time just sitting on the fit ball in between walks around the block, either expressing colostrum or I was just doing like a paint by number,
Yeah. Okay.
which was just a
Yeah.
really relaxing, happy thing to be doing.
Did she?
She got us to go.
Oh, sorry. I was just going to ask. Did she suggest you eat anything in particular or drink anything in particular?
No, she didn't. She just said make sure to keep up your fluids pretty much, but didn't kind of, yeah, she didn't say eat a spicy curry or anything
No
like that.
dates.
Or dates, but in hindsight, that would have been a great thing. I didn't even think of that on the day.
Good for constipation, whether
Um,
or not it works.
Okay, you throw everything at it in that situation. She got us to go into the hospital to emergency for monitoring mid-afternoon because I still hadn't had any contractions starting. So we had lunch and then kind of slowly went in after that. And we had some monitoring quite quickly and everything was all fine. And then we had to wait a long, long time to talk to the obstetrician, because they were wanting us to get booked in for an induction the following day if labour hadn't kind of kicked off. So it was probably about 2 p.m. when we went to the hospital, and I was feeling what I'd call kind of like tightenings, like when I really concentrated on my body, I could feel that regularly. It was about every 6 or 7 minutes at that point I could feel tightenings, but it wasn't painful. And gradually over that afternoon while we were waiting in emergency, it started to ramp up. And by the time we spoke to the obstetrician, which was probably about 6 p.m., maybe even later, it might have been more like 7 o'clock, I was having regular contractions that made me have to stop talking, which I was so excited about because I was just excited to experience what my body could do, and I wanted to avoid an induction if that wasn't necessary. Like I was open to that if that needed to happen, but I was excited that it was looking like it wouldn't have to happen. So at that point, I just signed the paperwork to get induced the next morning because I was having contractions and I was like, we're not going to need this anyway. Let's just get home so we can labour. We went home. I ate dinner. In hindsight, I don't know how I kept that down, but I did. Sorry, I'm just going to...
do what you need with little Mabel.
She's been enjoying listening to us talking, I think.
She's enjoying the story.
The story of how you came into the world, Mabel. So we had dinner quite late. It was probably about 8 o'clock, and put on the TV, and I was just sitting on the fit ball. And whenever I had a contraction, I would just breathe through it. And then I was talking like normal in between. We were just hanging out in the lounge room. About 10 o'clock, we thought, let's try and go to bed. And so I got ready for bed. I hopped in bed and I lay down and had one contraction lying in bed and just had to get up again straight away. It was not comfortable. It was really quite painful. And so we were like, all right, we're not going to be getting any sleep. And then for the next couple of hours, I sat on the fit ball just at the side of our bed. Oh, something I've forgotten. I put on the TENS machine once I
Oh,
got
yeah.
home from the hospital.
How did you find
So
that?
it was incredible. It was, I really, really enjoyed it. I had it on for the majority of the labor, and I would be really interested to know how I would have coped if I didn't have it. It felt really valuable.
And there we have
Um,
it. It's so hard to have a randomized controlled trial because you can't
Absolutely.
test that, can you?
You can't have the same labor twice.
No.
No. But yeah, it was
You loved it,
fantastic.
yep.
And it was just such an easy, like, there was no harm to giving it a
Yep.
go. So I thought, let's just give it a go.
Yep.
And yeah, it was really helpful.
Yep. And you had the booster
Um,
button, so you're just pushing it with every
yeah,
contraction. Yeah. Beautiful.
yeah. So between 10 p.m. and about 2 in the morning, I was just sitting on the Fitball next to the bed. And every time I had a contraction, I had my little routine. I clicked the boost button. I stood up with my hands leaning on the bed and I breathed and swayed. And I think I was quite quiet and within myself. And in between, this is so funny looking back. I just needed a distraction and something to focus on. And he was just sitting on the bed in between reading Pride and Prejudice out loud to me. I couldn't tell you what happened. I
That's
couldn't.
so sweet. Why Pride and Prejudice out of all the books? Is it one of your
It was just
favourites?
an inside joke that he had started reading to me as a joke during the pregnancy when I couldn't sleep. It's a book I've read before, but it's not like my favorite book
Yeah.
in the whole world or
So
anything.
romantic.
Um, and then probably about 2 in the morning, things started to intensify. Or a step back, I'd been in touch with my midwife throughout the whole afternoon and evening, kind of telling her where we were at by text. And then I called her probably 11 p.m. or midnight, kind of saying, we've got really consistent, strong contractions, 3 and 10 minutes. Like, just an update. What do you think we should do? And she said, just stay home. That's fine. Because she listened to a few of my contractions, gave us some advice, and told us when to call her back. And then at 2 in the morning, or maybe it was more like 2:20, the timeline's a little bit blurry.
Yeah.
I felt like my contractions changed and they weren't all up in my tummy anymore. I just felt intense pressure in my bum, like down in my pelvis.
Yep.
And I said, Tom, we need to go. Like, let's call the midwife. And we called her back and she listened to some contractions and she was kind of like, you probably could stay at home a bit longer if you want, but we can go in if you want to. And I said, no, Tom, we're going.
Yeah.
And so then we drove to the hospital. I sat on the back seat of the car, kneeling with my hands around the headrest because I really just couldn't sit on the normal chair. It just was going to be horrible.
Yeah.
And I just had my eyes closed for most of it, and I was still pressing the boost button of my TENS machine. And I remember opening my eyes maybe once or twice on the trip and just looking out of the car and being like, okay, we're making progress. We're almost there. We live, I think it was probably a 20 or 25-minute drive from the hospital at that time. So another thing that worked out really nicely was that one thing I was a little bit anxious about was, what if we need to go to the hospital at 5 p.m. on a weekday and the traffic would have been atrocious. It could have taken 45 minutes,
Yeah.
Worst case scenario, but it was 2:30 in the morning and the roads were clear.
Yeah.
So we drove in. My midwife had kind of teed up the birth suites and I remember the walk. Hello, Maple. I remember the walk into the hospital and stopping at emergency and having to give them our details, and then they kind of sent us into the birth suite. You all right, Mabel?
Do you need a pause?
I think we might, because I think she's got a dirty nappy.
Okay.
Sorry.
No worries.
Let's change your nappy, Mabel. You're doing a really good job. Or are you?
So I'll keep that going.
We'll just go across the house and change a nappy.
No worries.
Getting a nice tour of all of our roofs. Need a fresh nappy, baby? I felt you doing a poo. Oh. There we go. That better? That better? Would you like to play on the floor? All right, I'm good. We've got Mabel playing on the floor.
No, beautiful.
So
where were we up to?
I was arriving at the hospital.
Yes, you just arrived. Yep.
Is the recording back on?
Oh, I didn't stop. We'll cut
out. So we did the car trip. It was about 20 or 25 minutes. It was not super pleasant. That would be an understatement, but we got there. And then we talked to emergency and we went into the birth suite. And I was having contractions really often at this point. I wasn't taking massive note of how often they were or how long they were lasting for, but I just had seen over the course of the past hours that they were getting longer and longer. On the TENS machine, it told you with when you click the boost button. So they were happening quite frequently. We walked into the birth suites and I had a massive contraction right in front of the desk in the ward, which I thought was so classic. And I leant over the railing that they had down the corridor and just had this massive contraction. And I remember opening my eyes afterwards, and there was this young doctor standing there with his eyes wide, and he was like, "Are you okay?" And I just remember thinking, of course, like I'm laboring. It's okay. I don't want a chair. He was like, "Can I get you a chair?" I was like, "No, no, no, do not get me a chair. I cannot sit down." Um, but he just, I'll always remember his face. Um,
It was
um,
probably his first shift as
well,
a doctor or something.
I talked to one of
The maternity.
I told this story to my friend who's a midwife at another hospital in Melbourne. And she said, yeah, that would have been the first week of like the doctor's new rotation. So it probably was his first couple shifts. I'm glad he got to
That's
see a
funny.
naturally labouring woman come in. I thought that, yeah. Anyway, um,
Yeah.
we went into the birth suite and we beat our midwife there by a little bit, and the other midwives on the ward were looking after us, and we were just kind of, I was continuing to, I found during the contractions the best position was standing and leaning on something with my arms and kind of swaying my hips a little bit. And by this point, I was also bending my knees a little bit, I think, which just felt like it helped make more space in my pelvis. I don't really know. It just felt good.
Yeah.
We also had a student midwife um, who was one of the receptionists at the clinic that I work at. So I love sharing the journey with her, but we were too late to call her in to the hospital. So she arrived
Okay.
after Mabel was born. Um, so at this point, I think Tom called her or texted her. Um, Once we were there, it was about 2:45 in the morning. Um, when my midwife arrived, she came in and she was taking stock and asking Tom how things were going. And I just kept on having my contractions, and she watched a couple and she said, let's just switch things up. Let's take the TENS machine off and hop in the shower. And I was like, whatever, let's go with it. I was happy to do that. So I took the TENS machine off, and I was getting ready to go in the shower. And before this, I think she could hear that I had been kind of bearing down a little bit. And she was saying, try and not let that happen. Like, try and breathe through it and don't give in to your body pushing. Like, you're not there yet. And I was saying, I can't. I remember during the contraction, I think something that I did to distract myself was speak. And it would be simple things like in that situation, I was like, I can't. And other times if Tom was like, when he was supporting me, I would just look at him and be like, oh, I would say like, I love you, or something else that was really focused at him. And so I was speaking. And I think that also made my midwife not realize maybe where we were actually at. I'm just going to pick Mabel up.
I can hear where this is going, Ellen. I'm getting a sense.
Um, so I'm getting ready to hop in the shower. And I take off my pants and everything. And then the midwife, she was behind me at this point. She said, Ellen, like, reach down. Your baby's head is right there. Um,
No.
so I did, and I could feel
So,
Mabel's head and her hair. And I was so relieved, and so excited, because at that point I realized, like, oh, I was really, I think I realized, oh, we're going to actually be able to do this. Like, Mabel's actually going to be born. And yeah, anyway.
so leading up to that point, no one had a look down there. Like, no one had assessed you
No,
to see.
I didn't
No,
have
yeah,
any vaginal assessments, which I, looking back, really appreciate. I didn't have to lie down and get into a position that was uncomfortable. But it also
yeah,
meant, because obviously I haven't done this before, I didn't necessarily know that that feeling I was having was um, Mabel being
a
so like
contraction.
imminently coming when my contractions
Yeah, yeah,
changed. And in hindsight, I think I felt her crowning and like the the ring of fire kind of sensation when we were in the car,
Yeah,
um,
right.
which I remember kind of um, feeling in the car and being like, oh, that's nothing, whatever, didn't mention it, just kind of was like, just ignored it. But in hindsight, I think that's what it was.
And did you feel your contractions change from just like the tightening that you mentioned earlier to needing to like bear down, as you said before?
Yes. So they went from the really gentle tightening that gradually felt like period cramps and gradually got more and more intense over that whole evening.
Yeah.
And then it was 2 in the morning when we called the midwife. That was
Yeah.
when things
And
had
that's when you had
changed. Yeah.
the pressure in your bottom
Yeah.
area too.
Yeah. Yeah.
Yeah.
Um,
Okay. So you were in third stage labor without like you were
yes,
pushing
I think I was. Yeah.
without
Yeah.
realizing. Yeah.
Um, so
That's really remarkable, Ellen, that you weren't aware of that with no pain relief.
it was
That's a very rare story.
I have no idea. I have no idea how that all happened. But I feel very grateful that that was my story. Um,
It's amazing.
and I honestly think the TENS machine was very helpful, but also having like I was excited to labor, and I think that having a positive headspace about it and seeing one of the
Yeah.
things they talked about in Born Ready a lot was like, yes, there'll be a lot of pain, but it's a good pain and it's your body working towards your baby's arrival rather than a
Yeah.
pain that's because of sickness or injury.
Yeah.
And so
Yeah.
Tom and I really tried to talk about labor beforehand in that mentality. And we were so excited when the contractions came on. And I think that having that positive headspace also really helped a lot.
Yeah. Amazing. And what was the best thing that Tom did to help you during this process?
Um, he was incredible. He was just always there, or always there to physically help. Um, like uh how do I explain it? Oh, Mabel's sneezing. Bless you. Um, when I was having contractions, he was always there for me to lean on and look at and have like that. I had eye contact with him and he would be encouraging me throughout every single step of it, which was just incredible. Um, that was so helpful. And then he trusted me when I said, um, like when we were at ED earlier and I was like, I think I'm actually going into labor. He was like, you know your body, like, yeah, let's trust this. And then
Yeah.
later on when um at 2 a.m. when we called the midwife and she was kind of like, you can stay home a bit longer if you need to or you want to, like no rush, but you can come in if you want. And I said, we're coming in. Tom said, you trust your body, we're doing this. Like, I trust you. And
Yeah.
that was,
Yeah.
I'm going to cry just thinking about it.
Oh.
That was incredible as well to have someone in your
Yeah.
corner and yeah, just
Yeah.
the trust there was really good. Yeah.
Amazing. Okay, so you felt your baby's head. You're getting into the shower,
Yeah.
and you're like, "Oh my gosh, this is it." What? Like, how did it? How did that last bit go?
Um, it was a blur. It was incredible. I was just standing in the shower. Tom held onto one of the shower heads and put it on my tummy. Which he talks about now that he really appreciated having something to do. And he was right there in the action, but he also wasn't having to he didn't really want to guide the baby out or catch the baby or anything himself, but he was right there and he had something to do to help. So yeah, I was standing leaning on the railings in the shower, and started letting my body push a little bit more. I did, with my midwife's guidance, do a little bit more like active pushing, I would say, as well with the contractions. But it wasn't like a super long drawn out process or anything like that. It felt like my body was mostly doing it and I was just helping it along. And I think
Can you explain that a little bit more, Ellen? What active pushing for you felt like?
so when I was arriving at birth suites and kind of before we were in the shower and my body was pushing, um, it just felt like my body was pushing this baby out and I couldn't do anything about it. Then we went, which in and of itself was an incredible sensation, very powerful sensation. And then once we were in the shower, I would, I think with my breathing, just it was kind of like a pelvic floor physio would teach someone to do a poo, which is as you gently push on the exhale, and like let everything open up. That's probably what I was trying to do. But in reality, my body was doing most of the work for me, I think.
Yeah.
And yeah, my midwife, I think she did a little bit of a compress on my perineum. She was just behind me and I was standing and I remember I went up on my tippy toes. This is so weird. I don't know why it felt like it helped, but my knees were bent. I was leaning forward with my arms and I lifted up my heels and that felt helpful. I don't know, it felt good. That's why I did it.
Yeah.
And then I think we were probably in the shower for around 25 or 30 minutes before she was born.
Yeah.
And yeah, she was born and I was standing up and the midwife caught her and passed her up to me. And then Tom and the midwife helped us walk over to the bed and we sat on the side of the bed for a little while. And then they helped me into the bed. Yeah, it was just the most incredible feeling.
Yeah.
Yeah.
And they popped the baby on your chest?
Yeah, so they helped me into bed. I had been holding Mabel to my chest while we were sitting, and then they kind of helped her onto my chest.
Yeah.
And I just remember looking at her and holding her and just having no idea I felt like I couldn't move her safely and I don't know how to explain it. As a first-time mum, I was just like, what is this little baby and like how do I safely look after her? But they helped me to kind of move her into good position on my chest. And she stayed there for about 2 hours, I think, to start with. We just did skin to skin and we did skin to skin right through the placenta coming, which didn't take too long. That was while we were on the bed. I'd talked with my midwives beforehand about if we haven't had any intervention up to that point, I wanted to see how we went without having the injection up to a certain time frame. And my placenta came away without having the injection. I think it was 20 minutes or so after she was born. I really didn't enjoy that experience. It wasn't as painful as actually giving birth, but it was uncomfortable and a bit painful and just yucky feeling, like the placenta coming out.
Blub, 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 blub.
Yeah, it was so strange.
Yeah.
And yeah, I made sure to have a look at it and take some pictures of it afterwards because it's such an incredible organ.
Yeah.
Yeah, so that was just on my back in the bed while we were doing skin to skin.
Yep. And any perineal tears?
Yes, I did. I had a skin laceration. And then I also had, one midwife had a look and said, I think it's 1st degree, and this is like down towards the anus. And then another midwife had a look at it and said, I think it might be just 2nd degree. Let's put in a stitch just in case. So I did have a stitch.
Yeah. And so for those listening, the 1st and 2nd degree perineal tears are really common, but we know, like statistically, research tells us that they tend to heal really well postpartum. Recovery is really great. So I like to say that because one tear does not equal all tears.
No.
It's the third and fourth degree perineal tears that extend further to the anus that we're trying to reduce the risk of, and that's what perineal massage helps with. But like what Ellen's describing, a first or second degree tear that's adequately like stitched post birth tends to have great recovery outcomes. And 3 months later, how is that perineal area?
Oh, it recovered
and the
so
pelvic
well.
floor?
It was a bit painful for a couple of days only when I would wee,
Yeah.
like just the stinging. So I used a little bit of
Yeah.
water, like a peri bottle, but only probably for like
Yeah.
48 hours. And then it just felt a bit tender to wipe for a little bit longer. And then, like, I'd say a week after birth, I wasn't having pain or anything. It was just feeling pretty normal,
Oh, amazing.
which was awesome.
And then so good. And the other question I had in that, like straight after birth, you said you were holding the bubs and doing skin to skin for a couple of hours. At what stage did you try the first breastfeed?
I don't remember exactly what time it was, but I did try and have her latch within that first 2 hours, probably after the placenta came, actually. So it might have been like 45 minutes after she was born. And she was kind of a little bit interested, but didn't really latch properly. And then after the 2 hours of skin to skin, the midwife took her and did just the checks and everything. And she was a bit cold. She'd kind of, was struggling to be warm enough. So they were kind of looking after her for a little bit. And then I got them to bring her back to me as soon as they could. And we tried another breastfeed then. And then she latched a little bit better. With the midwife's help, I was, lost about like how to hold her and move her safely, and her neck and head and so fragile and everything. But they were very helpful. And they really did a great job of facilitating all that skin to skin for us. It was, amazing.
Yeah. Oh, amazing. Fantastic. So I'm aware of time. I want to discuss, especially I'm going to capitalize on the fact that you're a physio. Let's discuss your postnatal recovery. What were your goals initially? For your recovery, what did that mean for you to have a great recovery?
I think, and look, the recovery is still going. Like, I don't think I've reached all my goals yet, but I just, I wanted to get my body back to feeling strong. And I did want to go back and play netball again, which I haven't quite started yet. So that's still an outstanding goal. But also, I guess with my knowledge from work, know that it's best not to rush these things. And I went really slow at the start. And I think maybe 4 or 5 days after Mabel was born, we went for a walk, and it was like 100 meters down the street and back. Like, it wasn't far at all. Oh, Mabel. And then we just gradually built up. Over time. And
amazing.
I started doing some gentle core exercise and like glute bridges and stuff with the videos on your program, probably 2 or 3 weeks after birth. And those little videos were great because they didn't take very long, like often less than 10 minutes. And we'll just try and do them maybe 5 times a week or something like that, while Tom was on maternity leave still. And just gradually built up. And I'm trying to really see all the exercise that I can get done at the moment as a really exciting, good thing I can do for my body, and not putting pressure on. Like, it doesn't happen every day. And I don't feel as strong as I did beforehand, but that's okay. I feel a lot stronger than I did right after the birth now. And
and you're only 3 months postpartum.
Trusting and trying to enjoy the process. I can.
And are you going to do the return to running program inside fitness?
Yes, I hope to. Not that I'm a runner per se, but
I need to call it something different because it's not just you want to get back into
Yes,
netball. So it's like return to
yes,
impact.
I do. I've got an appointment with my physio in 2 or 3 weeks, I think, and then
Yeah.
hopefully she'll clear me to start doing a bit of impact. Um,
Yeah. Is that your first appointment with your pelvic floor physio?
no,
Postpartum?
I saw her at 6 weeks postpartum. I think,
Yep.
did I see her earlier? I think it might have been four or
It's
six
probably about
weeks.
that.
Yeah. And I've seen her a
Yep.
couple of times since. Just to
Yep.
get, and I've been, yeah, doing my best to remember doing my pelvic floor exercises. And yeah, she's been giving me guidance about particular exercises to make sure that I do in terms of general strengthening and
Yep.
all that kind of thing as well.
Yeah, amazing. So those for those listening, a pelvic floor physio appointment in the first 6 week, like as a bit of a checkup, we would assess your pelvic floor strength. We'd also assess structurally if there's any signs of prolapse. We can look at your abdominal recovery with any like diastasis. And then we can look into providing a rehab program to suit your whole body strength and pelvic floor and the rest. So amazing, Ellen. You've just been like ticking all the boxes. So good.
I've been very lucky with it just was a very healthy pregnancy and the way that we went into labor naturally, I think yeah,
Yeah.
really fortunate and yeah, it's been amazing.
Yes, fortunate. There is luck involved, but also give yourself credit where credit's due because you've really, I guess, invested in your body and your birth experience
Mhm.
and your recovery. You've invested right, from day dot. So
Thank you.
yes, we're very good at skipping over that.
I would say that the like physical recovery has been going along nicely. The biggest challenge for us in postpartum so far has been mastitis and more that side of things. Mabel's been breastfeeding really well, but I've had mastitis multiple times and a breast abscess and navigating the system and
Oh,
knowing
okay.
what to do. I've got a great lactation consultant who's been very helpful. But
Yeah.
that's really was a lot more challenging than I thought it would be.
Yeah, right.
So yeah, there's all different kind
And
of facets to the postpartum period.
oh,
It's
absolutely.
not simple.
It's not just
Yeah.
physical, is it? And with the mastitis, were you interested to see how therapeutic ultrasound responded
I
for you?
was.
Have you tried
I
that yet?
did. So the first time I had mastitis, I think Mabel was about 10 days old, and
Yeah.
couldn't, I just couldn't think about going out of the house for appointments that weren't strictly
Yeah.
necessary. But then
Yeah.
I got it again at about 6 weeks. And I did go in and I went in and saw my colleagues actually for a few sessions of ultrasound, which really helped to reduce um, the lump that I had
Yeah,
quite
right. Yeah.
significantly. And then
Yeah.
unfortunately, after that, and after I finished up the antibiotics and everything, it did turn into a breast abscess anyway. So I'm not sure
Yeah.
whether if I had more ultrasound, it would have helped with that, or if it was just that bout of mastitis was always going to end that way,
Yeah.
which my lactation consultant said sometimes that just happens. Um,
Yeah.
but it was really cool to see how the ultrasound did help to reduce um, the lump I had in my breast. That was really cool.
Yeah.
Yeah.
Yeah. Amazing. For those to wrap up, for anyone listening today who's perhaps pregnant and about to embark on their birth journey and the motherhood, what words of wisdom do you have as a first-time new mum?
Um, I mean, it's all well and good for me to say, like, trust your body and trust the process when I had an experience that did go so positively, but know that your body is capable of incredible things. And yeah, like there are situations where birth just goes smoothly without intervention. So take some
Yeah.
confidence from that and some positivity from that. Yeah, and try and be excited about it, I would say.
Amazing. Ellen, thank you so much for joining me on the Pregnancy Birth Recovery podcast. I really, thank you for sharing your story. It's so valuable, and it was so lovely to hear a beautiful, positive, pretty textbook, I guess, for want of a better word. It's just really nice to hear your positive story. Beautiful.
Thank you so much for having me. It was something that in those early weeks after birth, I remember talking to Tom and saying, I really wish I could share this story more broadly because I want to get the word out there that it can be really positive. So thank you for providing this platform and this resource for us.
Thanks, Ellen.
Thanks so much.
Thanks for listening to the Fitness Mama podcast, brought to you by the Fitness Mama freebies found at www.fitnessmama.com/free. So please take a few seconds to leave a review, subscribe so you don't miss an episode, and be sure to take a screenshot of this podcast, upload it to your social media, and tag me at Fitness Mama so I can give you a shout out too. Until next time, remember, an active pregnancy, confident childbirth, and strong postnatal recovery is something that you deserve. Remember our disclaimer: materials and contents in this podcast are intended as general information only and shouldn't substitute any medical advice, diagnosis, or treatment. I'll see you soon.